Chip Means from Healthcare IT News. I'm here at the GE booth at HIMSS10. GE is an anchor exhibitor at HIMSS, and so obviously their booth is enormous. You can see it stretches all the way from that side over there with a second level. And we're going to get a tour of the booth today. We're going to talk to GE about some of their new products, and I'm also going to be speaking with Mark Denty, who's the Chief Medical Informatics Officer, about what GE is trying to do to help patient care move along.
So today what we're going to end up doing is we're going to take a look at a couple of opportunities that really hammer home the opportunity for patient care, that delivery, that ability to address access, quality, and ultimately cost. So if you happen to see the Olympics with our Healthy Imagination kickoff, it really is about saying, what is the value, what is the commitment, and then how can an organization like GE recognize that we can contribute opportunities like Qualibria, our new knowledge management platform, to do clinical decision support to drive quality care at a patient level. So we want to take a walk over here. How can we take data from a number of different areas that may not be GE customers? So this is a non-GE focused product. You can be running a number of different legacy technologies or GE technology, obviously. Bring that together and then say, how do you actually now normalize that data set so I can run queries against that to drive best practices? So what I really want to be able to do is to say, hey, if my patient came in with a stroke, in real time, can I have a view of that helps me understand that I only have 20 minutes left to get the patient to CT according to the national measures for best quality practices on stroke. So not only can I do the retrospective analysis of this data, how's my practice doing, how are my patients doing within that, it now gives us an opportunity for real-time data aggregation and viewing of that information. What we have here is we want to take a look at just a quick overview of Qualibria and show how one can actually go way beyond dashboarding. So this is not just, gee, I aggregated some data.
Yeah.
Right? This is saying, whether it's a GE system or not, we're going to take that data, we're going to normalize that, so all the vocabulary ontology work that we've done with folks like Dr. Stan Huff out at Intermountain Healthcare and Brent James that understand the concept of not only delivering technology, but in fact the delivery of Lean Six Sigma to healthcare. How do we think differently? How do we prevent the error from occurring in the first place?
This is a really interesting one because it's providing the opportunity to actually take action on the data that you're seeing. So again, a difference between a standard dashboard. We want to pull together a bunch of data from different sources, but also make that data actionable. And we're able to do that by elements such as clinical decision support mechanisms, such as a little clock right here. So I know that John Phipps, I have 25 minutes left to get him to his CT scan based on the protocol that's been set up by my healthcare organization for a stroke patient. I can create one of these lists myself. So we were talking about the infection rates in a hospital earlier. So I can go in as a clinician right on the floor. This is my little terminal, and I can pull up a template to take it upon myself to improve infection rates, in this case within the organization. Pull up a template that in this case was defined by a chief quality officer or a quality organization in my hospital, using variables that they want to track to make sure that we're reducing infection rates in the hospital. So if I click on that template and add that to my list, when I close it, I see that the columns that are being shown are basically the variables and sets of data that my organization has defined as what I should follow as a clinician to make sure that I'm tracking a patient against possible infections.
This represents a tremendous amount of work that's been done at the ontology and vocabulary level. So we are absolutely a standards company. We promote and actually actively support all the different standards initiatives out there, whether it's ICD-9, CPT, everything from meaningful use standards with CCHIT and what the Office of the National Coordinator are doing, all through that. But the reality is, at some point in time, you want to start to run a sophisticated rules engine, such that they're running out at Mayo Clinic or Intermountain, in our case. Kaiser's doing very similar things. If you want to get to that sophisticated level, you really need a rule that can fire at a more granular level than the national standards will allow you to get. great technology where Qualibria is, really exciting. We're so proud of what we're doing with Mayo and Intermountain, and how we're going to build off of that. eHealth actually layers in under that. So this is a technology that actually enables a lot of the data to be aggregated outside of the institution. So if you are a large entity or a RIO, here's the technology that drives that.
Two things that you might want to think about if we're diving global. Health information exchange today, there really aren't any large HIEs, right? The volume's about to increase dramatically, right? I mean, the good news is everybody understands the importance of connecting the healthcare ecosystem. The real question we need to ask is, who's building the right infrastructure to be able to scale? Not scale just amongst provider and care service organizations, but also to connect nicely with patients. We think the opportunity to use this clinical information sharing not just as a way of passing information and eliminating air gaps. I mean, in the process, that's very important. The real opportunity is, how do you enhance doctor-to-doctor collaboration? How do you enhance doctor-to-patient collaboration and build it in a way that's scalable so that when you're sharing billions of documents, your system still responds nicely? GE is an infrastructure company. That's what we do. eHealth is an infrastructure business, and we're really working to put a scalable, robust, terminology-rich health information infrastructure in place so that we can share information nicely across the health ecosystem.